Karachi, federal government premises, and 6 in Islamabad. And I have personally, so far, we have inaugurated 6 so far. 2 in Karachi, 4 in Islamabad. And I personally go to all those inauguration. It's a very small thing to me, but it's a very big step to fulfill these gaps between of our healthcare system here in Pakistan. So this is, and that's working tremendously. Just to share with you that people, the doctors, especially the female doctors, who have not been in this in the system, in the healthcare system, they are qualified, but due to their own personal reason, they did not practice. They're the normal housewives, sitting in their own houses. Those doctors are being brought in the system. While sitting in their home, they are fulfilling this job, to see the patient sitting somewhere, very far away. I was visiting that day to one of the BHU, and a doctor was online, and patient was in one of the very remote area of Islamabad, outskirts of Islamabad. And when I asked that where this doctor Saiba is sitting, so I came to know that she's sitting in Qatar. She was sitting in Qatar, Doha, and seeing the patient here in outskirts of Islamabad, how tremendous, how revolutionary it is all about. And so we have provided the specialists 2 days in a week. There will be specialists sitting online. There will be child specialists, and then five kind of categories are there where specialists will be provided. What I'm trying to just bring in front of you this August gathering is that government is very cognizant about this whole thing. We do understand the gap, and our directions are very clear. And not only the talks, we are working our talks. Actually, what we say, we are doing it. We are practically doing it. Yes, it's not being very visible because it's just the beginning.